My name is Professor McGurk. I'm in the head and neck cancer unit at University College Hospital and heading up their new academic head and neck center. I started this charity about 10 years, no I don't think so, perhaps 5 years ago, with the object of introducing minimally invasive treatments into the subject of head and neck cancer, a new development for head and neck cancer, because technologies allowed us to do it. New technologies are making it so easy to adapt to the individual patient and reduce treatment and tailor treatment just for them. The HnCF story really came about as I came towards the second and third part of my career. I'd spent a lot of my time doing major surgery, and with it there's a lot of damage to patients in the head and neck, the visual area. And also there's been this dramatic improvement in technology. When I started, there were no CT scans. So all of a sudden there was these abilities to try and reduce and improve surgery, get it smaller, less damaging. And it was trying to get that message out. And so HnCF came about because we wanted to get the information out to our colleagues and the public, so that I really want to emphasize the public. The public are so important in this message, both for themselves and for the rest of the population. And the idea is really to reduce damage to patients who have got cancers and disorders around the head and neck. HnCF is a small, almost a little boutique type charity, and it can't compete with the great cancer research institutions in the UK. So it has a particular little role, and it fills a gap which these other ones are not aiming at all. So they're looking at the fundamentals of cancer. We're not doing that. We can't. It takes millions and millions. What we're looking at is that it's going to be years before they cure cancer. In the interim, we have to treat it. So we want to make that as palatable as possible. We want to get the diagnosis early, the treatment neat and tidy, and not leave people damaged like we are at the moment. So we're filling that gap, and technology is helping us. The key is technology. It's a burst in technology what's happening, and with it we can harness that and start to tease away, get things earlier, and make the treatment much more palatable and easy. People can live a proper life afterwards. The mission for HnCF, I think, it's got a couple of components. One is awareness. Awareness for the surgeons and what we're developing, and trying to get them to adapt it. And that's quite an uphill struggle, actually, more than you'd think. The people who are really going to drive this on are going to be patients. And my objective, or one of the objectives of the charity, is to actually inform people, inform them about what to look for, but actually what's available. That's more important. That you must know what's available. You must ask always, is there any other way of treating this? Is there other developments going on? And that is something I'm trying to do. The other one is to develop these techniques, these minimally invasive techniques, and we've got about 4 areas where we really have changed things. The charity's helping with them. We've run conferences, international conferences, getting the message out, and people do not have to have their jaws removed anymore for certain types of tumors, and the minimally invasive mouth cancer sentinel node eliminates neck dissections in 80% of people. These are big improvements. We're just trying to get it out to the public, and so you can ask questions when you are faced with a problem. To a certain extent, the public have been quite passive up till now, always being listening to a doctor and taking what they've said. But quite a lot of these developments are happening quickly, and the general practitioners are not aware of them, and in fact many of the specialists aren't. So what the public can do is be aware themselves that they have some responsibility in getting the right treatment. It's not just the doctors, because not all doctors are well informed on things. So What the public can do is talk with each other, and the main thing is when you get to your specialist, please ask him, are there alternatives? Is this the only treatment? Is there anything new? Could they provide any information for you? Those are the type of questions that will stimulate a change in the environment around you, because that's what we're looking at. We're looking at a very conservative environment, very safe for you, but not quick to pick up things. So your role is to ask questions. Most general practitioners, with regards to the mouth, with anything that is persistent, will refer you on. So it's not so much the GP you're asking questions of, it's actually when you hit the hospital and the specialist. And you should be inquisitive. Actually, quite a lot of doctors don't like you searching the internet, etc., but there's nothing wrong with that. It gives you questions, and questions are good. So what I would suggest that is charities like ours will have information on their websites, reputable ones. You don't want to go off into the stratosphere and pick up all funny stuff. Reputable things will give you questions you can ask, and your job is to ask them. And it's only then that you'll be given information that you're allowed to choose from. And the law stands behind you on this. The law actually says that you should be given these choices. So our role with you is to give you as much information as possible to tune a treatment just for you. Basically, mouth cancer has a propensity to spread, and it tends to spread to the nodes in the neck, and we knew that. And we found it very difficult to cure people if you waited for lumps to appear, so everyone got a neck dissection. Quite a big operation, 3 or 4 hours, and obviously operations of that magnitude leave you with aches in the shoulders, particularly in the old days when it was more radical, and scars on the neck, etc., and a general discomfort and stiffness of the neck, nerve injuries. And this is all because 20% of people have the problem and 80% don't. So we actually did this operation on 80% of people who didn't need it at all. So the question is, can you detect those little cells coming into the neck early? And up until now we haven't, couldn't do it. In the last 10 years or so we've developed these techniques, not alone, across Europe, and we can find cells. We can find 5 cells, 3 cells, and we can then avoid surgery in the 80% who don't need it and give it specifically to the ones who did, and then adapt the treatment. So instead of missing them, so quite a lot of neck dissections would miss those 5 cells and they would report them as no problem in the neck. Actually, we're picking those up and we can then change our treatments to catch them even better. And I think we're starting to show improvements in outcome, not just in how the neck works, etc., but actually in survival. So this careful analysis, attention to detail, is what the sentinel node does for you. This has age that comes into it. When you're young, you're cavalier, you're interested, you're passionate, and you see or you look over quite a lot of the damage. But as you get older and older and you live with these patients over the years, you suddenly notice as they grow old with you what you've done. And now that you don't need to do it, it feels so much nicer to be able to offer someone something where you know they can live with the repercussions of what you've done and live a normal life rather than be dragged along with things getting worse as time goes on, and difficulty in eating and problems with teeth and problems with swallowing. So the ability to actually leave someone with a normal life is so much more gratifying and satisfying now. And it's like a gift you can give them, which I couldn't do 10, 15 years ago. The symptoms to spot, this is quite tricky, of course, because there's lots of little ones that you get caught out on. First of all, you have to know what normal looks like. And we've done a video on that. And so if you go to the website, there's one that shows you what normal is. The things that you're looking for in the mouth, it's relatively easy. Most of our cancers take a long time to develop. So they start off with sore patches that last for 6 or 7 months. They sting, they burn. Any ulcer that lasts a long time, 3-4 weeks, you need to look at. And pretty well all the tissues in the mouth are soft. So if you put your finger in, and you can learn more with your finger than your eyes, if you feel along and it's a firm, hard spot, particularly if it's a bit tender, and the really important one is if you're getting earache on the same side. Those combination, a sore ulcer with earache on the same side, means you need to go to your doctor. One of the big achievements is that I'd like to reassure you that we're not just using your money, but we're harnessing government money and other charities, and we've just been able to win a £1 million grant. Now, actually, even with this grant, you are playing a really big part, because at the last minute, the firm that was going to provide the drug will not provide it. And that means that we're £70,000 short, and guess who's stood in to support us, and that is HnCF. So even in these big projects, which this small charity can't cope with, you are playing a really important role. So a £1 million grant is substantial for us, and it's a real, something we take a lot of pride in, with you, of course, because you have been central to it, to push the subject forward. So we're taking sentinel node out of the mouth, back into the throat and into other parts of the body to try and reduce damage elsewhere.